Hello, my name is Dr Kieran Moore. I'm a consultant paediatric psychiatrist. That's quite a mouthful, so just to let you know, I'm a medical doctor like any other who treats illnesses in children. I specifically specialise in treating children who have medical psychiatric illnesses. This is a video to help parents, i.e. you, to continue to help your children with ADHD. It's designed to help survive the social isolation and having to stay at home due to the COVID-19 virus. It's not advice really in mental health per se. There's a lot of that advice available already, for example, on the HSE website. By definition, most of your children are already under the care of doctors working in child and adolescent psychiatry services or CAMS, along with other non-medical team members, and you should contact them directly first if you have any concerns. There are three broad symptoms that affect your bundle of joy in various ways. The first is hyperactivity. If your child has this, you know it. This is not occasional bursts of energy, it's All-Ireland hurling final day when there used to be one. Intensity 24/7, constant movement and no sense of danger. The intensity may decrease in adolescence to be replaced by a tapping, fidgety, squirmy child. Second is inattention or poor concentration, and you can measure this directly by the amount of hair you pull from your scalp as you curse COVID-19 that has suddenly made you the teacher as well as the parent of a child. Your child may have difficulty reading or spelling and maths, and you may also find this difficult. They will actively avoid homework, and some may sit with the books, and when you come back an hour later they're still on the same page. Impulsivity is the third one, another big word. It means they never look before they leap. ADHD to me is like a mobile phone if this helps. When there are too many apps open, the phone gets overwhelmed, overheats, groans, sticks its tongue out, puts its feet up, and its screen goes black. Give it a few minutes and you can restart it, except this time when it comes back there's only one program open if you're lucky. Everything works a treat after that. The same thing happens to your child when they get overwhelmed by life. The problem is I can never find the restart button on a child. Luckily there is a software answer, which is medication, and the medication filters the sensory input and keeps only one app open at a time, and it helps. So what should you do during this time of COVID-19? Firstly, if you have any medical questions, ask your doctor. If you have non-medical questions, ask other team members. Make sure you have a valid prescription for your child. Prescriptions can be faxed directly to your pharmacy or through your GP if you have a medical card, and nowadays pharmacists can even extend prescriptions if they need to. Treat all medications with respect. They can be dangerous, you know this. If you already have a medicine cabinet, use it and lock it. If you don't have one, try and get one, and whatever you do, put the keys or the medication somewhere where only you know where it is. That does not mean your handbag or under your bed. Your children are much smarter than you and will cop on. Medication, when you're taking them, for example the psychostimulants, take them at the time they are prescribed. They will be written on the bottle by the pharmacist. If it's later than 11 a.m, wake your child up to take it, as later than this can interfere with sleep. Watch for side effects. Decreased eating is the commonest. During the day it occurs and is usually compensated by the child at night time. Along with ADHD, your child may have many other difficulties, and the important thing to know is that your child is far more than just diagnoses, but it's important to know what the diagnoses are so you can help them. Give all your children something to do. Try old-fashioned games like treasure hunts. It's amazing, they actually like them. Put some limits on access to technology. Children with ADHD are more prone to addictions generally, including technology, and I mean that actually, but they can be useful at this time for social contact, so just put a limit. Within the confines of where you live, try and encourage some exercise. You can get children to set up exercise sessions themselves, and they actually quite enjoy that. Break up all tasks into single units. Check your child is listening, say what you want. For example, we are going to do 5 maths questions in 15 minutes. After that, you will have a break for 5 minutes. Use a timer. Praise your child when they're doing well. Identify known triggers to getting overwhelmed and prevent them. Talk to your child and answer questions about the COVID virus as well. Support and soothe your child. Explain it can be serious, but all of us can manage it by staying at home and socially distancing. Look after yourself as well. If you have medical needs, contact your doctor as normal and follow the advice. Take all your medication as planned. Keep in contact with your own friends and family frequently by telephone or other. And lastly, enjoy your time and have fun with your children. This time will end. COVID-19 will not continue forever, and you will never spend as much time with them again in your life. Have fun if you can.